Understanding blunted affect and its differentiation from other emotional disorders.
Hello and welcome everyone. In today's video, we are going to delve into a deep topic that can help us better understand human emotions and emotional disorders. We will specifically discuss blunted affect, its signs, symptoms, and how it is different from other emotional disorders.
What is blunted affect?
Blunted affect refers to a significant reduction in the intensity of emotional expression. People with a blunted affect may seem emotionally indifferent, unresponsive, or disconnected from the emotions they are expected to feel. They may exhibit little facial expression, have a monotone voice, or display fewer movements. It is important to remember that blunted affect does not imply a lack of emotions. The person might be experiencing emotions internally but having difficulty expressing them outwardly.
Signs and symptoms of blunted affect.
Identifying blunted affect can be challenging as it's largely about perception of emotional responses. Here are some common signs to look out for. 1. Limited facial expressions. Individuals with blunted affect often have fewer facial expressions. Their faces might appear blank or impassive, even when discussing topics that would usually provoke an emotional response. 2. Monotonous voice. Their voice might lack the inflections that typically convey emotional responses, leading to a monotone or flat speech pattern. 3. Decreased nonverbal communication. There might be a decrease in the use of gestures or body language that typically accompany emotions. 4. Reduced response to emotional stimuli. These individuals might not react as expected to emotional stimuli. For example, they might not appear happy at good news or sad at bad news.
How is blunted affect different from other emotional disorders?
It's essential to differentiate blunted affect from other emotional disorders. The main distinction lies in the nature and direction of emotional responses. 1. Blunted affect versus depression. While both may involve a reduction in emotional responsiveness, depression is typically associated with persistent feelings of sadness, hopelessness, or a loss of interest in activities. In contrast, blunted affect involves a lack of outward emotional expression, regardless of the emotion being felt. 2. Blunted affect versus anxiety. People with anxiety disorders might display a wide range of emotions, often heightened, particularly worry or fear. Blunted affect, on the other hand, is characterized by a lack of outward emotional expression. 3. Blunted affect versus emotional numbing. Emotional numbing, often seen in conditions like PTSD, is an inability to experience any emotions, positive or negative. On the contrary, blunted affect does not involve a complete lack of emotions, but a difficulty in expressing them outwardly. In summary, blunted affect is a reduction in the expression of emotions, making those experiencing it appear emotionally detached. It's crucial to remember that this does not mean the person doesn't feel emotions; they might simply struggle to express them. Understanding these nuances can promote empathy and better communication. We hope this video has shed some light on blunted affect and its differentiation from other emotional disorders. Thanks for watching, and take care.